Good afternoon, ladies and gentlemen. My name is Dr. James Lyons-Weiler, coming to you live from Pittsburgh, Pennsylvania, the WWDNYK studios. Today we have a special episode where I'm actually going to be interviewed by this guy right here, Dr. Louis Russo. Louis Russo, how you doing, mister?
Good afternoon. Doing well. Yourself?
Right on. I'm doing well. I was joking about the doctor part. You know, it's a thing we do. So,
What are you saying? Doctors are jokes? Come on.
yeah. Well, you certainly think deeply. That's for sure. So,
Thank you. No, I appreciate it. I think it's
what I thought I'd do is make myself available to you to ask some questions about this in-home private testing issue. It's quite controversial in getting people to understand why it's so important that they should act on this. But why don't you tell people a little bit about how we met?
Certainly. So I have a friend who lost his father to essentially the practices of medicine. How large allopathic industrial medicine is being practiced. He was forced to. Well, I can't say forced. He was left with the ultimatum of lose your pension of a job you've had, for over 20 years, and be fired or take this injection. Now, he had a physician who he took this information to, and the physician said, yeah, based on your current condition, this injection poses a risk. He weighed it out. His family meant more than his own safety, so he took the injection, and within 5 months, he died. That's what brought me into the State House in Columbus and meeting a group, and then subsequently meeting you. And ever since then, I've been in lockstep with many of the things that you are involved in, as far as, the government. You're obviously handling the clinical and medical side of things. I'm more handling the legislative side of things, obviously.
Yeah, so we had you on the show here.
Yes, that's true. I've been a guest on your show. Thank you. I appreciate those.
Yeah, and we're going to have you back when it's legal again for us to be in the same room. But although this works, for now.
Well, we can also use alcohol as a disinfectant. So
that's very important. I think it's very important that people understand our gamesmanship in that regard. If you don't, then you're just not over 40. So what can we say?
Yeah, pretty much.
Right on, brother. So go ahead. What do you got for me?
Yeah, well, this is what I wanted to do. So you brought up a really good point in many of the discussions I've been watching, and one of which is called the Back to Work program, which, correct me if I'm wrong, you entirely designed, authored this thing, right?
Yeah, it's the IPAK Back to Work program, sure.
Okay. And I guess kind of going into the details of this, because a lot of us will have questions, what does this look like? What's your idea? That sort of thing. Because you've been very vocal in your support of antibody testing. That's pretty much the clinical side of it, antibody testing. So can you tell us about antibody testing and how it would differ from, like, let's say, RT-PCR testing?
Yeah, absolutely. So the IPAK Back to Work program itself is a great place to start, because what I see happening are, people that are just going to want to open society up and everybody go back to work. And what people need to understand is that if that happens, then there will be a second surge of infections. There will be a second peak that we have to look forward to. It's not a new virus that's going to come. It's the same virus. It'll start recirculating, and then the people that want to mandate vaccines and the people that want to mandate testing will have their day. See, it didn't work. Look, we went back and it didn't work. And when that happens, you're playing right into the hands of giving them the bully pulpit, being able to mandate not just testing with RT-PCR, contact tracing, and all the rest, but also mandating the eventual vaccine, which, as we know, hasn't undergone proper animal safety testing. So the benefits of antibody testing are twofold. First of all, I've run into some. I've been researching them. I've run into some that are extremely accurate, very accurate. 99% sensitive. If you have it, it'll find it. Like if you have an
Wait,
active
you're
infection.
saying that there's tests that might not be accurate?
Yeah, though that's I'm gonna address the concern. So right. So 99% sensitive means if you have it or have had it, there's two aspects to the test. It's 99% accurate, over 99% accurate. If you don't have an active infection or you haven't been exposed, then that's also 99% accurate. And this is from a test that's from Vibrant, some company with Vibrant in their name. I'm not very good at tracking it because I don't have a vested interest, apparently. But uh, the, I looked at the technical sheets, and those technical sheets are outstanding. They have inter-observational reproducibility. So if two people give the same test, it's very accurate, over 95%. And they also tested it against a whole slew of other pathogens. It's 100% specific to COVID-19. And so this addresses all of those concerns up front. Compared to RT-PCR, which we don't see the accuracy statistics for whatsoever, the RT-PCR test is the one that was shipped out by the CDC. It's also, if it's used, it has to be done clinically. It doesn't have the option of being done privately. And so we want antibody testing if you want to be tested at all for your own purposes. You want to have antibody testing, and also it's really inexpensive. These at mass consumption, these tests are like $10 a pop, and so we use antibody testing all the time privately. We use it for pregnancy testing. That's an antibody test. Nobody, and we use it
So
in
you're
other
saying this is
circumstances.
pretty much proven in a sense. I mean, obviously.
Yeah, absolutely. Each individual assay has to be validated and so on, but this Vibrant company and others have achieved FDA emergency use authorization by submitting research showing that it's very accurate.
Okay. So I've
I'm
been,
sorry, I didn't
you
answer
know
the
me.
question. I didn't answer the question, Louis.
Yeah.
So the question was, what's the difference between antibody and RT-PCR? So an antibody
Yes, that was
test
the root question. That's true.
Antibody tests actually test for the circulation of antibodies that are actively circulating in your blood. Antibodies are proteins, so it's a protein-based assay. PCR tests are DNA or RNA tests. If it's a PCR test that tests for DNA, you need DNA. If it's testing for RNA, it's called an RT-PCR test. An RT-PCR test is reverse transcriptase, and it takes the mRNA, the messenger RNA, and it reverse transcribes it into DNA, and then you go forward with the test. This all happens inside of a test tube. It's not like it's changing your RNA into DNA in your own body. So
No, I get that. It's like a template
you take a nasal
replication
swab, which is
response.
you take a nasal swab, which is not accurate for this setting. You take a throat culture swab, like a poke with a Q-tip, and that's the source of the RNA, and that has to be done in the clinic. And if you test positive, then the CDC has to report under the law your age, your gender, and your zip code, and that's it. They don't give your name, social security number, address, nothing like that.
At least not yet.
Well, I'm talking about current law,
Yeah, yeah.
right?
But
So I know a
I
lot. I
think
understand a lot of people are really anxious. There's a high anxiety. There's a lot of mistrust. They don't know. They're waiting for a hammer to fall, and I want to address those concerns. And I want to lay out in this interview that in-home private antibody testing is the way to make everything else obsolete, to make it all unnecessary. But go ahead. You had another question.
yeah, yeah. So I'm no stranger to Facebook, obviously, and some social media as far as getting into discussions like this, not necessarily with persons as yourself. Unfortunately, I wish they could all be Dr. Jacks, but
Thank you.
this is what I've been seeing a lot: a big buzz about Bill Gates's immunity card and quantum dot tattoos. So are you familiar with that?
Yeah,
Is what
absolutely.
you're talking about have anything to do with that?
Yeah. This has absolutely nothing to do with that. In fact, this is the opposite of that. So the
Okay.
idea that you would ever have a vaccination card or an immunity card is anathema to free, independent, red-blooded Americans such as yourself. The government has no business knowing your immunity status, your immunization status. It's your
Isn't that a HIPAA
business.
violation?
Well, HIPAA, yeah. So what I'm saying is that the Bill Gates plan is what will happen. Absolutely. Unless every person in every state that hears the message calls their legislators and says we want private testing. It is the alternative to the Bill Gates program, even though I came up with mine first. This will, because I saw it coming, obviously, it will
Right.
stop
Just good
mandatory
guess.
testing, reporting of your testing results, and so on, dead in the tracks. Because, as I think we'll get into, there are benefits to knowing your status for your own information. And once you know that information, and of course, a lot of people are going to say, well, what's to stop them from demanding your results? The answer is you. You calling your legislators and saying, I want private testing. And if you're not sure about what I mean by private, after you watch this, look up the hashtag private means private and add your own thoughts to private means private on that thread. There's one thread on that, and see if you don't understand now what we mean by private. It means you go to the store, you buy it, or you order it online, it comes to your house, you unwrap it. In fact, I'm going to show a video at the end of how this is done at home. And you take a prick on your blood, you put it on the assay, you take a reagent, you drop it on there, you look at the result, you throw it away.
Now,
That's it.
would I have to report that result to the government?
Absolutely not. There's
What
no
about my
reason to
employer?
report that. Just like a woman who has a pregnancy test doesn't report her pregnancy test. Now,
Okay.
right? And if a parent tests their kid for drug use with a private in-home testing for drug exposure, you
So
don't
this
have
is
to
really,
report
sounds like
that.
what you're saying is non-mandatory private testing.
It's non-mandatory. It's personal choice consumption of a product, a medical product that you, or a farm. I guess it would be some kind of a product, and you buy it and you bring it in your home in the privacy and secrecy of your own home. You understand your
But
own
doesn't the CDC
immunities.
require all reporting to be, or are all testing to be reported to them?
Now,
All
so no,
clinical testing, I should say.
okay, so here's the answer to that. No, CDC does not require all reporting to be done to them. What happens is if you are tested by a medical physician, they have to, by RT-PCR or antibody, they have to report that result. That's a clinical test. And we see it,
Okay.
well, I'm going in and I got a clinical test that's approved for clinical use by the FDA. That has to be reported, but the only thing that they report is your name, your zip code, and your gender for disease tracing. That's it, okay? But
Right.
the medical doctor doesn't even have to know about your in-home testing, and you would only tell them that you took an in-home test if you wanted to. And so we're going
Okay.
to, so no, it's very different. There's clinical testing, and then there's private testing. We're advocating
So
for
what's the
private
advantage of
testing.
of the non-mandatory private testing over clinical testing?
Well, the advantage is privacy. I mean,
Okay.
it's 100% private.
And choice, right? I get to choose rather than.
Absolutely your choice. This is not voluntary submission to a test. This is not mandatory test. This is your choice. It's like, well, I feel like a hamburger today, so I'm going to go out and get a hamburger. I feel like having a vegetarian patty today. Okay, this is consumer choice, choosing a test because you would like to know your status of COVID-19, whether you are infectious with an active infection, or whether you had an active infection in the past and you're now likely to be immune.
Okay, so would you mind giving some examples? Because I understand if you're IgM positive, okay, you have an active infection. So let's start with that. What would I do if I were IgM positive?
Okay, so IgM positive means that you have a new or active infection, in which case, depending on your symptoms, if you're getting really, really sick, you might seek medical care. And if you seek medical care, they're not going to take your test result because it's not a clinical result. They're going to test you again for medical reasons. So there's a very, very different test. It's a RT-PCR test that they're going to do with the nasal swab. If you're IgM positive and you feel fine and you have an active infection, then you would choose of your own accord to act accordingly and act responsibly. For instance, if you know some friends that have diabetes and you know that diabetics have a 6.3% mortality risk if they get infected, you might not want to visit your friend with diabetes or have them over. You might not want to go visit your grandma. You might want to stay home or visit her by video. All right. So, but you're in control of that choice under the IPAK Back to Work plan. It's private testing. You get that positive result. You make your own decision about what you're going to do with it. You might consult a naturopath about a high dose vitamin A, D, E, and so on, like Dr. Brownstein advocates and others, high dose vitamin C and so on. Or you just might spend more time in the sunshine because you want to get your case over with. I don't know what you would do, and that's the nature of choice. That's the nature. It's your private information. You're infected. You choose what you do with that information under the IPAC Back to Work plan.
Sounds like really any other infection for that part. So let's say if I were IgG positive, right? That means that it's a past tense situation. I was exposed and I have the antibodies. So what then in that situation?
Okay, so right now, for instance, I do a lot of social distancing, right? I try not to be in large groups. I'm careful when I go out and go shopping and so on. But if I was sick back in January, so if I was IgG positive, I would be much more bold. I would be free of my choices. I'm not going to infect anyone. I'm not going to become infected if that's a concern of mine. I listened to one doctor say that she wanted this kind of test because if she could go from patient to patient to patient to patient, she said it was like a superpower to know your IgG status. If you know you're immune, you don't have to suit up. You don't have to use the PPE, the personal protective equipment. And so people are starting to advocate. Now, listen, Louis, I've been on top of this since the end of January. I've been ahead of the CDC, ahead of NIAID, ahead of HHS, ahead of everybody on this, calling for social distancing. Don't put and so on.
Well, you
don't
even
put your
had a hand in developing, accurate testing methods. Isn't that correct?
Yeah, absolutely. That was my
fundamental asset of information that was needed.
Well, on testing, yes, but in terms of this entire situation, I've been ahead of the curve on this. All right, so I was tracking this,
absolutely.
And what I'm saying is now, what people are saying is, oh yeah, we do need antibody testing for the medical people. Bullshit. We need medical testing for everybody. I'm sorry, antibody testing for everybody if people want it, right? And so I'm not saying that and nothing that the IPAK Back to Work plan should ever be seen as leading towards mandatory anything, right? It is the opposite of mandatory anything. But IgG status, let's say you're negative. You're IgG negative. That means that you haven't been exposed yet. So you might want to know whether you've been exposed or not.
Right. So here's my question under fire.
Right on.
What if I am IgG and IgM negative? My result is the test is completely negative. What would you recommend then?
Okay, so what I would recommend then is that you make your choice on the basis of the risks that you perceive about the activities that you are about to undertake. That means that you are a potential candidate for an infection, right? You might be less likely to shake hands in public. You might be less likely to hug someone in public. You might be less likely, you might want to use the elbow fist bump. You might be less likely to go to large gatherings. But as the rest of society, as the infection courses through society, the rest of society will start doing large groups again because their IgG, I would presume a rational person, a rational mind would say, I'm IgG positive, so yeah, I can go to church. Yeah, I can go to that of my own accord. So
it sounds like information is obviously being informed as a citizen is obviously extremely empowering. It allows you to be more responsible and accurate in your actions and choices.
Right.
So last question under fire.
It's not a roadmap that tells you what to do, but it's information that's incredibly valuable to you so that you can decide what you think you should do.
Right. If I know the potholes there, I can act accordingly. And then this is the last under fire question. So you know me, I'm a big advocate of the Constitution and upholding our freedom. And going from point A to point B is not always abundantly clear. So the concept of private testing and then your IPAK Back to Work program, what can I do as one person to make that a certainty in my life?
Yeah, well, right now, I think what everybody needs to do in all 50 states is call their representatives. Yesterday, President Trump made it abundantly clear that the governors in every state are going to decide testing for their state. That means the people now have the power. You have the power to call your representatives, congressional representatives and senators at the state level, and say you don't want any mandatory testing, but you want private antibody testing to be allowed in your state. Okay? There's nothing whatsoever about the IPAK Back to Work plan that involves any reporting to any central authority. It doesn't involve anything other than some guidance, right? Get your governor to look and your senators to look at the IPAC Back to Work plan in guidance in how to interpret and act upon if you're IgG positive, IgG negative, if you're IgM positive, IgM negative. And those are it's a guidance. Now I know a lot of people are going to say I don't want the government involved in whatsoever. But if unless we tell the government what to tell us, what to do, we are abdicating our right and role and responsibility for self-governance. This is your chance. This week is your chance right now to get your ideas about what you want in terms of testing into your governor's head, and if you're in your senator's head, in their mind. And if you call them up and you say you don't want any testing whatsoever, no testing, they're going to hang up the phone and say thank you for your input. They're going to just think you're a crank, right? But just like people want the choice to vaccinate or not, this is the choice to test or not, but it's private. And so you should absolutely want, if there's going to be any testing whatsoever, you have to fill the void with something. And that's something that I want for myself. And you may want for yourself in the future, even though right now you don't want it. If you were a dictator right now, Lewis, and you were anti-testing, and you said, I'm going to ban all testing for COVID-19, no one's ever going to be tested. There might be a day when you might want that test yourself. Your kids might want that test yourself for them, someday. If this thing's going to stick around like they say it is, yeah, we might want to have the respect and dignity of our own, knowing our own body's immune status without having to tell anybody else in the world.
Well, I appreciate being a good sport, taking those heavier questions into account, because they were obviously broad and not as easy to answer. I appreciate it, and that's a great answer. I think for any extreme, enforced public testing and banned testing, those two extremes are really examples of non-freedom. Like you said, there's the dictator situation. If it's optional, the dictator could just choose to not get tested. Just because it's available and not enforced and it's private doesn't mean that you have to get tested. So, I mean, it's pretty hard to argue about. And it sounds like a very good legal methodology. I've gotten my share of tickets and I go to court to fight them. And if you sit there and say to the judge, I don't feel I should get this ticket, you're going to get the ticket. But if you make it easy for the judge to dismiss it with compelling evidence, well, then you're going to get dismissed because you're making their job easy. And it's the same thing here. If we reach our leadership and say, hey, look, we're the people, we represent the collective of Ohio, and we're telling you this is what we'd like to see, they want to keep their jobs. And they know that every person talking to them is going to vote them in or out of office. So absolutely, they're going to listen to what's being said. I mean, I've been directly related to this. We have about eight House representatives right now that we have close relationships with in our advocacy group, and we've had results. We've had bills completely shot down or at least delayed. We've had other bills that suit the public interest put up for vote,
Sure.
And it all goes by communication. Absolutely.
So I want to clarify also that this in-home private testing has nothing to do with contact tracing. Contact tracing occurs after you've had a clinical test. So if your doctor can know your status from, say, RT-PCR, if you're sick and you go in and you say, I have a cough, and they just say, well, I want to test you for COVID, shouldn't you be able to know your status independent of your doctor? And isn't it safer, if the idea is to shut down social contacting, that in the future we test ourselves at home so we know if we have to go to the doctor? Otherwise, they're going to burn through all their personal protective equipment, and we're trying to avoid empowering.
That's why the initial protocol was they would only test people with symptoms because they had to ration out their resources.
That's exactly right. And they made it a scarce resource, which also drives up the demand. But we're trying to disempower tyranny and empower people's choice. That's what this is all about. So, Lewis, why don't you join me as we watch this video of an example? I'm going to narrate it. I have the sound turned down. This is from Hong Kong, I think. So this person's opening up a package, and in this, you've got some sterile wipes here, and you've got the reagent. The package comes to you this way, and she's going to open it up, and there's blood involved. So if you don't like to see blood, there's a little poke of blood. What she's saying is that it's on the packet. The results are very easily interpreted as horizontal lines on the assay. This would come to your house, or you go to CVS and pick it up. You open it up. It turns. You've got two wells here where you're going to put the drop of blood, and these are the assays here and here, the IgM and the IgG. Now, see, this one has ID and date on it. That's not necessary for our purposes. What she's doing is she's taking out the sterile wipe and she's sterilizing her finger. And you should let that alcohol dry before you do the test. It could invalidate the result of the test. And obviously, don't blow on it. This is a lancet, just like a blood test for sugar. It's a tiny little pinprick.
Ouch.
That's exactly what she says in the video. Ouch. So she squeezes it. Now she's got a little pipette, and that pipette takes up the blood. And she's got a sample of blood now in the pipette. And you should use the right amount, not too much, not too little. And then she's going to put it on the IgM assay or on the IgG assay. She's squeezing her finger to get some more. And now you add a reagent. This is where the antibodies are that will either react or not react. This is something that will react or not react to the antibodies in your blood. You'll get 1 band or 2 bands per lane, and it tells you your status. She waits 15 minutes. And now you can see, I'm going to pause this because she's moving it all over the place. You can barely see it, but there's...
Yeah, the lighting isn't that great.
Yeah, there's a band here. There's a slight band here. And...
looks like 4, right?
Yeah, there's either...
Oh, okay. It's a totally different color. There we go.
Right. So based on this, and based on the interpretation here, you're either positive for IgM and positive for IgG, or you're negative for IgM and negative for IgG. And look, it's called NCOV. This is how early they had testing in Asian countries. So yeah. That's it. That's as simple as it is. It's not complicated. Now, what does she do with the package? In my case, in my world, in the United States, you throw it away. That's it. You know your result, and that's it. Here that has an ID and a date. I think in this country they're doing contact tracing based on this, so they may in fact have to report. That's why it's so important, right, that we get behind this IPAK Back to Work plan. Because right now, how many people in the United States are already immune to this, but they're on lockdown? That's absolutely ridiculous. The government,
yeah, like you said, we could be back to work. Yeah.
The federal government has announced that they want to do contact tracing and all this stuff at county by county by county. And Trump is announcing, no, my executive branch is not going to do this. No, we're not doing that. What we're going to do is we're going to let the governors deal with this. And they should take control of what's happening with testing. And if they need help with testing, the feds will come in and they'll help guide them through what testing is. They're talking about clinical testing. All right. And if it comes to a mandatory test, we've lost the game, because if the government mandates a test, that means it will be reported. We want private in-home testing, just like you just saw in the video, that is 100% your business about what the outcome is, 100% your knowledge and information about what you're going to do with that information. So, Lewis, right now, if you were IgG positive, what would you do? IgG. You
Like the
got an active.
Superman.
No, IG. Yeah, you're Superman. You can take off, right? So IgM positive. What if you're IgM positive? Then what?
I'm going to do what I've been doing, which is social distancing, staying in my home, leaving only when necessary, not touching my face. And for the audience, the 3 times I've touched my face in the video, they were disinfected before we started. So,
Well, I'll tell you, buddy. If the minute that we're both tested for IgG and we're both positive, we're going to have you back in the studio. So,
absolutely, I can
no,
toast to that.
right on. So, any lingering closing thoughts? Any final thing that you want to say?
Is there a website I can go to kind of point me in the right direction, or anything that you have that you're posting to help people get launched into this movement of, hey, I want to see this IPAK Back to Work program happen, and also something that we can give to our senator or governor, like, let's say they do have an ear and we get their aide on the phone and they go, well, great, what's this thing you're talking about? Let me take a look at it and we'll get back to you. Where can I go, or actually, what can I give that aide to show Governor DeWine, so that they can research it and take it under consideration and pass it as something that is the placeholder for what, like you said, is going to be the inevitable if we do nothing.
Yeah, absolutely. Thanks for asking that, Lewis. I'm going to bring up the actual webpage on the IPAK webpage right now. So here is the IPAK webpage, and it's the IPAK Statement on Diagnostics. There's a let me just go here. If you go there, you'll find that there's an IPAK Back to Work protocol, which is a Google Docs document. Okay, you can download that document and you can send a link. You can do whatever you want with it. Then there's also a proposed IPAK. Let me see. There's an IPAK Back to Work IgG IgM testing guidance schedule, and that's it. And a copy of our letter to Secretary Azar. So you can download all of that. And there's also on this website, there's the copy of the letter, text of the letter to Secretary Azar, where we're saying the CDC screwed up testing so bad, they put us in this position that we don't want the CDC being involved in anything on testing anymore. That they don't belong
Yeah,
being involved in it because they couldn't even make a test that worked one time. How can they validate other people's tests? But
yeah, they
this,
released those 2 plane loads of people who were infected because they were using a SARS kit. I mean,
right, right.
yeah,
I
that's
mean,
incompetence. That's gross incompetence. Actually, the president did announce that he's considering. I don't know which way it'll fall. This is 2-day-old news. He's considering launching an investigation on the WHO and cutting funding.
well, actually, he made an announcement, didn't he? That they're going to be cutting it off. So yesterday.
Oh, so it's yeah. What I read was he's considering it, so it looks like he pulled the trigger. Yeah.
Yeah, I think so. So when you get doubts about this and you're not sure about it, and for the people that are watching this on Breaking Science here, and you get doubts about it, come back and watch it again and watch how they did that test in home. Watch how that person did that test in home, and what you do with the information. You have that information in your hands. Nobody knows you bought the test. Nobody knows you own the test. You have that information in your hands. What you do with that test information is entirely up to you. We have to win this fight. Otherwise, we're going to have a totalitarian medical government. I'm arguing for medical emancipation, where you can make your decisions on who you're going to associate with, what you're going to do, the choices you're going to make, and so on, whether you seek medical care because you have a bad cough or not, on the basis of your information. And I hope that that's now abundantly clear. And if it's not, I'm not going to be discussing it any further. I'm just going to refer people to this video. I'm going to refer people to hashtag IPAK. Private means private. And there's also a hashtag IPAK Back to Work. So, Lewis, thanks so much, buddy.
Excellent. Oh, thank you, and I enjoyed once again being a guest.
Right on. Talk to you again soon.